have a ceiling around them. The one, those that attended the theory class, the red one that attended the theory class, they have a ceiling where they support the patient from behind, just in case the patient wants to fall off or they are unstable. If you don't have the one that has the slings, you can ask somebody to put behind to support the patient. For the patient runner, we can increase the bed height to make it easier for the patient. But if the patient will be able to stand up from there, there is no need also for us to increase the bed height. And as a therapist, you can use this to help sit to stand for the patient as many as possible. So the one will put his hand here or here, depending on which one is comfortable for him. And all he needs to do is usually this equipment you use it with two people. Okay? One person will give the patient, and then the other person will support the piece of equipment. There is a footrest where you, the person standing here, will put your feet just to stabilize the equipment. Can I have this volunteer, please? You understand? This time, just put your legs on. Yep. Then just one. Yep. And all I need to do is, I'm going to stand up. I'm not pulling you. I'm just supporting you. Okay? I'm going to stand on the wall stand. Okay? Ready, steady, stand. So the person here is just to make sure that the patient is safe. But if you are confident that your patient can stand and will be able to stand, then there is no need for two people. All you need to do is one person to support you. That's if you are confident your patient has the ability, he's not very impulsive, he's not going to let go of this at some point. He has enough strength to pull himself and is cognitive ability also. If not, I would encourage you to always have to balance. Okay? Right on the board. You want to stand here. And from here, all you need to do is you can swivel to the last one. Swivel to the back, and then come with the other chair. Use your hand, wait for your chair. So it's acting like a patient. So no matter what, once you have the hand strength, you can do it. You want to put yourself up in the yeah, put yourself up. Okay, ready, steady, start. And then from there, you can do your patient. So from here, you can just take a patient from sitting on the edge of the bed to the chair, from the chair to the. I can see Haji Fatima is doing like this. It's an expression of it's easier for you to shuffle forward and then normal to stand up and then because you require a lot of effort for you to inspire so you see what you don't and then I think the patient you saw yesterday, you make a case study for you to use tomorrow. Yeah. Yes. Yes, Abdulrahman. Yes, sir. And for the car, this one can use a transparent frame. Sorry? This device can be used for transparent frame. For transfer the frame. Yes. Absolutely. I think for me, I will absolutely be able to use this for to start practice. Okay? Where I will encourage the patient to stand up and then they start and count a couple of times before they sit down. And then I will lower the bed using the height. Yes. Any height measurement on the height of the knee support. What you call it adjustment. As usually, You know where the tibial tuberosity is? Yeah. If you know where the tibial tuberosity, so the tibial tuberosity is where the patella tendon inserts. Okay? Just after the knee, so if you go, this is your kneecap, if you go the patella tendon, the tibial tuberosity. So you know from there, because what you're looking at is a part that protects the bony prominence, whereby because if it applies on an object, the bony prominence are usually the one that will complain. So you don't want that. So you have to try to target around, cover that area from that tibia to the rostrum, slightly above that, all the way down to the shin, whereby you can see the patient's neck is well protected. And then, so that's where I think mainly where you can sort of target. You can also target the kneecap, but I think mainly around that area is sort of good, because that tibial tuberosity.
I think that place is more spongy type.
Yes.
It's very soft.
Yes. Yes. So there are different pieces. There are the one that is more stable than this one, the red one, the big one. But all of them has to be used with somebody. So what I mean by coming off like themselves, I mean one person stabilizing this, and then nobody will stand beside you. Okay? Usually one person stabilizing this, and nobody is there. Okay? So usually one person stabilizes this and supports this, and then you stand up and then the person switches. So what type of patient do you think can be able to use this? Okay? Almost all categories. Okay. Hello. Suleiman asked a question. He's imagining how can a hemiparetic patient use this? Now my response is it all depends. Now, if you are using it for a hemiparetic patient, let's say this is the hemi side, right? If there is no problem with shoulder subluxation, well, even there is, I can put shoulder splints. What I can do is, involving the affected arm will help the recovery. I can try to, if they don't have good strength, I can try to encourage them to grab it, and I will support this hand, because this one is supported. Yeah? Let's say this is the weak leg, and they have, let's say, 2. Remember, we talked about 3 is the one that they got 2. But if they can be able to bear with even if it's 2, there is no buckling because this has protected it. And with me standing here and somebody here, I can use it by supporting this one. The person I will encourage him to grab it. So this is a functional tack strap where you are improving the function. I will support this one and encourage the patient to use this hand, but it will require a bit more support, not necessarily purely for transfer with other healthcare professionals. This one you can use it for your rehabilitation with functional tack strap. Secondly, I can use bandage. Okay, I can use straight bandage around here to make sure that it's just here, and that will increase the use of power when they are transported. I use it for rehabilitation in a functional tax practice or tax specific practice. Okay, can bring it out. So the next piece of equipment, if there is no question that we'll be looking at, is the banana board. I believe for the banana board, we have come across it, yes? No? No, okay. But what do you think we will use the banana board for? Okay, from bed to wheelchair, from bed to chair. So you can use this for transfers, okay, for patients from chair who necessarily without them all the way standing, where they cannot be able to stand. Okay? Patients that cannot be able to stand, you can use the banana board or sliding board to transfer from one platform to the other without them fully standing on their legs. Okay? If you can see, this is a nice smooth area. This is a bit of rough and creepy area where we support them. For the banana board, apart from using it in your practice, for those that are long-term paraplegic patients, spinal cord injury patients, it's a good piece of equipment that we can train them to use it for their day-to-day practice, whereby without relying on people to come and help them get into the chair, out of the chair, if they can be able to stand up and sit at the edge of the bed, with the banana, they can be able to shuffle from out of the bed, from the bed into their wheelchair, and they continue their business without necessarily somebody there with them. It is an equipment that certainly you can train persons who are completely paralyzed, maybe from lumbar region down, but they have the upper limb function to use it that will promote their independence and function. How do we use it for? Now, usually some wheelchairs have detachable arm, whereby you remove the arm and then you remove it before you put it. Some don't. If they don't, you can think of use the cuff point to just go around the handle. Okay? The cuff point to go around the handle. And if a patient doesn't have sitting balance, or if a patient is at that low level of ability, you will need some second person to support them behind. Okay? We need a second person to support them behind. Let me have somebody just to stand behind the patient while we do this. The same thing, we will try to bring the patient to shuffle forward. Okay? Can you shuffle forward for a bit? So we are transferring Suleiman from chair to from the bed to the banana. What I will do is, in terms of the foot placement, I will put my feet in the direction of the foot. Okay? So I will just bring the neck into this direction. I will bring the neck. So I'm putting my feet into the direction, foot placement. I'm putting my feet into the direction at which the patient is moving. Okay? I'll put my feet in the direction of the movement, and I will put my banana out. So let's say Nino will be helping me, so he will help me to go down. Okay? So the patient will go to, remember how we talked about from one side to the other. Try to lean on this side for me, please. So use your hand. Good, Suleiman. And then with the patient leaning, all I need to do is I will slide the banana boat all the way inside, and then I will put the rest on the bed. And I will ask, come back. Good. That's it. So here, there are two ways you can move the patient. You can do a one big swoop movement from here all the way to the chair, or you can do two movements whereby you bring the patient halfway and then at the end. Okay? Another thing that you mentioned, usually this is an angle where put it at an angle. When the person, so two big movements, one halfway and one inside. That's one. Hand place, hand place. When you are doing two big movements, you need to be aware. If you are doing two big movements, be mindful the patient doesn't put their hand at the end. Can we have the other banana so that so if we are doing two big movements, when the patient is sitting, be mindful that his hand must be putting at the end, because that will press the hand, and that's another problem. So usually just put the hand at the end of it like this. That's if we are doing two big movements. And we go to do two big movements first, and then we go to do one big swoop movement on the banana. And if we do the big swoop movement, Suleiman will just help you support good, and then help you good. So I'm supporting the pelvic good, so we're going to move slide. Okay, steady slide. Okay? Now we're going to go halfway. Okay? Okay, why don't you not use your hand? Okay? Let's go for it. Okay? Ready, steady. Okay? Now that's one. We didn't use the elbow, and I use breaking swim. So, and then the next thing is you take this hand off, and you put it and then I will just adjust the leg. Yeah, just support the chair. Okay, we're going to go very steady slide. And then that's it. And then Yes. So the bed is already at high. You don't want to. Yes. You can tilt the bed up. I think it's always best to bring the bed up. So to make it more slow. Yes. Always start the bed is going from top all the way down. Yeah. I think this is okay because I don't want to do high. And then if you're going to the reverse also, you can kind of put it down. And say, okay? And then we do it the same way. Although this time around we don't have this, we just reverse it and just put the hand here, and then we come forward for it. Okay? So we're going to go from this position, ready, steady, strike, and then you take the hand all the way and just the feet all the way to the direction of the movement. Ready, steady, strike. Okay? Last, if you're doing two movements and then I adjust the feet. But if I do a one big swoop movement, also always moving from a high position to make it easier for you. So try to bring it up slightly. Better. Moving. Yeah, I think that's okay-ish for me. If I do one big swoop movement, I will go for the opposite. I'll try to do this and get for you. Okay. And then I'll just position the leg in the direction of the movement. So Suleiman, you try to move with you, okay? And you can probably stand at the angle because we are going in this direction. Okay. So we're going to go ready, steady, slide. And then that's the second class. What we move the banana ball. Once we move the banana ball in the same way, it comes to the right direction. Lift your ball up. Good. And then you just move the banana ball. Okay? Yes.
His positioning.
When I think for me, going on your knees is easier. I know I'm going to run the most right. So instead of going on your knees, I yes, right. Yes.
That's long.
I think it's, unless it, because it's going to the banana button, sorry, I think some people have made a question there and anybody outside there can make it.
I think so every implement of modality is
Absolutely.
yes. So in the absence of a situation whereby there is higher, I think you can use other devices to make that transfer. Not necessarily you must use the button. Not necessarily you must use it. You may as well use thread, smart thread, to make that transfer. For our colleagues who are practicing in local government areas, where there is no such these devices, you can provide giving the board, you can make a normal looking board, you can design it and make it to your banana board. And you can as well use other devices like maybe the Zimmer frame for the transfer. And for this banana board, if I may choose, I would like it to present this situation. Hello, I think, hello, it's my yes. Hello, this is the question my head is smiling saying, yes, I may choose it to be more active and passive. I will put other devices like this one and similar for passive transfer in digital settings.
So I think what Suleiman mentioned is absolutely not smart. But what he was trying to say is that whenever you are actively involved, you look for an equipment that will take away that manual. Okay? So, but when a patient, the equipment, when a patient can be able to do it themselves, they use for equipment. Now, this one is what I showed in terms of manual involvement. Now, we're going to do the same bits whereby Suleiman will use it himself as much as possible. And you can use it for your patient whereby they use it for themselves as much as possible. Whenever possible, avoid where you using your effort to move the patient. Where possible, encourage the patient to do it themselves using those equipment. Okay? Using those equipment. If you cannot, if you have the luxury of this, use it, but if you don't have the luxury of it, you need to just figure it out. Yes. Yes, I will show Suleiman. Suleiman will do it as much independent as possible without me involved in it, and then we'll take it. But the same is, Suleiman will put it as a slide So Suleiman can actually do it by himself. Try to adjust the banana board and then see it by himself. You can do that. You want to put the one all the way across. All right, I think, the emphasis is if the patient can do it, let them do it themselves. Okay? And I told you most of these things, the patient, once you train them, I think the main thing is training them and then allowing them to do it themselves. Okay? And then you can also bring yourself back. Very high, okay? All right, yes, any, yeah.
Because there are patients like injuring this might I haven't really touched it, but I don't know how
It's actually very, very, very. However, there are ways. Yes, yes, there is a way. Usually there is a way description of how much you can on all these products. That's hello, hello. Yes. Hello, any question? Do you think there is a patient in your clinic that will benefit from this in tomorrow practice? A lot. HODs here, they are looking to borrow your equipment, sir. Well, to Zaria. Just let him apply. Yes. Hello, before we can we have a practice? Is there anything else before we go? Before we break for practice? Any question? Or any addition? Any comment? Any addition? What other things people use for patient practice transfer from one point to the other? Yes.
I was was trying to
yes, carry on.
mostly in our clinical practice, most of us, or I could say some of us, used to leave patient once they leave the hospital.
Yes.
And this banana body could also be used at home, like for instance, toileting. When the patient is going to use maybe like you mentioned, the wheelchair user of you can make use of this transfer from wheelchair to toilet.
Yes.
So I just feel like it's necessary to say this because we used to forget once the patient leaves our hospital, it's on his own. So I think it's good to include this.
I think what the man is mentioning, it's a whole day training on its own. Self-management or continuity of care. In practice, believe here we have so much emphasis in hospital, but in other countries they are even heavily investing in community practice and discouraging hospital admissions. Because how much a patient stays in the hospital is just a fraction of their lives. And if you really want to make a significant difference in their rehabilitation, you need to think of what they will continue to do after they leave your hospital. Some of the patients can be equipment, like it's right can be encouraged for the patient to continue using their hand. This banana body, by I think it's a self-empowering piece of equipment for patients to be as independent as possible. And for those who have permanent disability, they will, I will 100% encourage them, especially if they are planning dysfunction, to consider having this because that will take away the number of people that will come to their house carrying them and then they will go back into their acceptable training. Once you train them, all they need to do is have this, have a home set up, and they can get out of the bed into their wheelchair, from the wheelchair. They can then go and do their business and come back. In terms of going to the toilet, what I would recommend, which we don't have here, is the commode. Okay? Commode. So the commode is basically a wheelchair, but it has a toilet underneath. So once a patient is transferred from the bed to the wheel commode, you can wheel him. Some of the commodes you don't have to use the foot underneath. You can just go and put it on top of the toilet, and then they will wheel, and then you bring them back, and then they will sit down. This is some of the equipment, especially for those with, of course, I know availability. In other settings, it's a routine equipment. It's just like paracetamol. It's a basic required equipment that you have when the patient tick that boxes. However, where it's the question of availability, then it might be difficult. However, the patient have permanent long-term disability that's going to continue for a long time. I think he needs to consider that if they can afford it. Because it's better for them to have this space rather than a lot of movement up and down and things like that. Yes, availability. We have a contractor who will supply the shipment for us. Yes, sometimes it's not only about yes, awareness. I think for me, I would say the number one is the awareness because if you don't know, even if you have the money, even if it's right beside you, and you will not use it.
That's why even in evidence base now, there is patient therapies and patient related management.
Yes.
What is that's what I call it. I just tell them it's a permanent disability.
Yes.
What you do that will aid you. What you do what you use that will aid your life to be easy.
Yes. 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 And what you are saying is the ownership of rehabilitation, okay, is not only physio. The ownership of rehabilitation is to the patient as well as their families. It's not about what we prefer or what approach we like. We have to make them own the process for them to be able to benefit from it. If there is no more questions, we have 4 pieces of this. I will allow you to practice, and we have 1 piece of this. Now we have a quick practice of using this before we come back I'm going to give you 45 minutes each maximum. Let's sorry, sorry, somebody is saying something. Yes. Yes.
The challenge still is the size of the bed compared to the wheelchair. The height, sorry. What Ismail said is improvisation.
Yeah.
And when, even in the improvisation,
Yes.
it provides for people that have some power for the one.
Yes. Yes. In provision, yes.
Yes.
Power.
So people with some power,
Yes.
and value.
Yes.
Assuming now this person is
Yes.
placed,
Yes.
there is no power at all.
Yes.
And you want to move him
Yes.
from a bed that is higher like that one into the wheelchair. What can you use?
So that's a very good question.
That is the best that we have. We don't have access
Assuming a patient doesn't have power globally, and this is a good option for him, but the bed doesn't allow that. What can you use? Any suggestion?
You advise him.
That what? That you should get him bed?
Yes.
This is difficult. It is difficult, of course. Because
Okay. Okay.
Maybe 2 steps rather. Another one, and then
If you have that,
let's
someone wants to be independent at home. Most of our parents
The problem is that it's
most of our
yes. Hello. Yes. Yes.
the bed is higher.
Yes.
The chair or the wheelchair. I may adjust the chair next to not next to the bed and use two or three.
Yes.
Since the bed is attached to the bed, I'll place 2 pillows or 3 as the case may be.
Yes.
just one practical.
So I think
It's doable. Let's go.
yes. You want to learn best practice. But what I would say is that when you are using the pillows, because it's very squishy, okay? So you need to be mindful. Maybe if it's hard enough, because some of them are just squishy, and then but again it will give that nice transition. But if it's hard enough, in the concept of the pillow, you can find any object that is hard, and then you balance. Yes, it supports the patient.
Can we try? 2 or 3 pillows is very hard.
Can you come down one pillow?
Makes sense.
Now I see.
It's that.
What should it say? The only thing I would say is, the only thing I would recommend, when you are doing this, I usually prefer the patient eats out on the floor. Now I know it's a tricky situation. We are all talking of improvisation. But what I would recommend is the feet on the floor, just to give him that support and everything. But if you don't have, I will just try it. It's an option, but it's not the best.
You can get a stepper.
Maybe
You can get a stepper.
stepper. Yeah.
Okay, stepper.
Should we practice this or should we? I think we have less than 1 hour. Should we move to the next thing so that we can practice all of it? Now, am I going to try? Now, we'll practice that. What type of patient do you think will benefit? So this is called a mobile voice. Okay? The mobile voice, because there are different types of voice. There is a ceiling tracking voice. A ceiling tracking voice is used especially whereby this word is for this type of patient, and you just put a ceiling tracking voice, and whenever we are seeing this patient, this is the word that will put there. For a patient with long-term permanent disability, they usually have a ceiling tracking voice in their home that they use it for them for moving from one place to the other. So this mobile voice, what type of patient do you think will benefit from this type of voice? Quadriplegic patient, yes. Unconscious patient, yes. So this is the highest piece of equipment in terms of patient moving and handling. When the patient cannot be able to help themselves, all other pieces of equipment, we try them, it's not going to support the patient. Okay? Whereas the patient is heavily dependent on people moving them. And you can use a voice for the transfer of the patient from the bed to whatever position. Okay? You can also use voice when a person is on the floor to pick them from the floor to back to the bed or from the floor to the wheelchair. Now, with the voice, it comes with a sling. Now, this is the sling of the voice. There are different types of voice. It comes with a sling. This one is not for this one. This one I just brought in part of it for the demonstration. This is a loop system. It has the loop system. Apart from this loop system, which luckily enough it's the same as this, there are the ones that have like the anchor that is being used for. For the sleeve, it comes in different sizes. Okay? There are small, medium, and large. And you measure the sleeve on your patient. Preferably for those patients that have like this, the head rest, it covers all the way from the head to the coccyx. While if you don't have the headrest, it just covers from the C7 to the coccyx. Where do I find my C7? Or just around that C7 here. I'm going to use the one. Where do I find my C7?
Prominent vertebrae.
Prominent cervical vertebrae. So just around this area. Okay? If I actually want to extend it like this, it will disappear. It will like this, it will come up. Okay? So from the prominent C7 all the way to coccyx. And I can measure it by just putting my sleeve all the way, and I know that this will be first one. Because if it doesn't have a head like this, that will be the measurement of my sleeve. Okay? But this will be more than enough for one. Okay? So that's one of these how you can see. But again, for our patients, they don't stand up for you to measure it. Yes. For the sling, you need to be aware of the straps. Because the one thing you don't want is somebody hanging in the air and then it snaps. This kind of conscious patient, for example, they don't know where they are, and then falling it is catastrophic. So I think whenever you're using this piece of equipment, to make sure that all the safety checks are in place. The slings, there should not be bruises or cuts on any area that is coming out, so you need to make sure it's all intact. For the voice itself, usually there is in different countries. In the UK, there is a law requiring the governs the use of all the electrical equipment, mainly on the use of voice. The LOLA Act. The LOLA, one of the things is that the voice has to be serviceable. It's serviceable to make sure that it's proper working condition. Whereby you test it so that you don't just apply it for patient every day, every time. For those of us, for people who have, if you find yourself from the voice, you have to check. Whenever they service the equipment, they will have the date attached on it. If the voice does not have, is not in date of service, you should not. Okay? That's where they have the law. Check it, and if it's not in service, even if it is working, the advice is to use it? Insurance will not cover. But I'm not sure if you have a law like that. But this kind of conversation that is yeah, South Africa. Okay. So, what do we need to look at in terms of the hoist? It has a battery. It has a battery. Now you can remove the battery and you can put it back. Therefore, the battery you can charge it overnight. Some of them there are different types. But this one, I think it charges itself. It charges itself from the battery. It charges itself once it's attached on the machine. Emergency brake. And in order to this system, what it means is that once you lift the patient up, usually it's not very fast, like boom, boom. It's just slowly up and down. So usually if the patient is, maybe the patient is conscious but something happened, postural hypertension or anything, you press the emergency brake and then it brings them all the way to the down. See? So that's what, it might not necessarily be working here, but again, we will try it, but just to mention, usually they have emergency brake, and the main of the emergency brake is you just press it and then immediately it lowers the patient down. And if the emergency brake is pressed, the hoist will not work. So you have to pull the emergency brake, okay, for it to be used. It has brakes. The hoist have brakes, and these are the brakes. But guess what? The only use of these brakes is when you are storing it. It has no use when you are using it. When you are lifting the patient, brakes off. Because once the patient, especially when the patient is in it, it will balance itself on the tires and balance, it finds its center of gravity and balances itself when the patient is standing. If you put the brakes, it can tilt the hoist on one direction or the other. So you brakes off when you are bringing the person up from the hoist. The only use for it is when you are storing it. And then you have the legs. Some of them, when you open it up, you widen it up, and you close it. Okay? It depends on how you want to use it. Some of the legs can go a bit far wide and back, more than this, but this one is also folded. You narrow it down. For example, when you are going to put it on maybe under a chair, it depends either you put it all across the, you want to take it all the way, and you open the legs on and you take it all the way. But when you put it on that bed, you can close it and then put it on that. So we're going to practice the use of this hoist. Let me see if this one will work. Okay. That's fine. So when you're doing it, those ropes are for a purpose. When you are working with somebody, you have to communicate with them. What color are you putting? The color you put on the one side, you have to put it on the opposite side, because you don't want the patient to be dirty. Usually it depends also. When you are putting the patient into lying position, okay, you want them to be long, so that the person will lie down. But when you want them to sit down, you want them to be short, long, so that the squat will bring them into sitting position, and when you are putting them there, they can be in that same position. So lying down, sometimes you do long swings. When you are bringing them into sitting position, here will be short, here will be long, so that their legs will be in that instead of them lying flat, fine, they will slightly in this kind of position. And the same thing you run everything from start to finish of this training in the morning. That's the same thing you will do. Patient training, we remember what we discussed in the morning. That's the same thing we use to apply these skills. Okay? Although the removal of it, which I will show you, might be different when they are sitting on the chair. So what we're going to do for Suleiman is we want to transfer Suleiman from lying in bed, let's say bed reading, into sitting in the chair. Okay? We're going to use the hoist to transfer him from lying in bed. So we transfer Suleiman without using his leg from here all to here. And I will leave one person, please. You have it? So just let's see if I can come this way. And yes, the problem, so some of them have this, okay, this track. Now this track is when you are doing it, you have to it all the way through, so that when you're picking the person up, their legs will not be open wide. Okay? Those that don't have strap, they cross it over from one side to the other, from one side to the other. But those that have strap, you just put it so that their legs will not be just spread wide when you are moving. Yes. So I think what we did, we want to just so that we go. So we are putting the sling. So this sling we are putting underneath the leg, and then we are putting on this direction. Okay. So that's why. Then this one is this side. That's why we see we are putting the strap. Okay. So that the strap will be here. Yeah. So we want to move it. Can you assume that you are not a normal patient?
That's good. Yes. Excellent.
Okay, just so that we don't see. So, yes, the mind is a perfect model. Even me, I just, it's too much for the time. Okay? So let's say this is it. So what we do is we are putting this, and then we are putting it in this direction. Now imagine if you pull this like this, and you pull this like this. If the person is going up, it can spread the leg apart. So that's the importance of this in some way. So you just put this like this, and then you pull it side by side, and it keeps the legs together. Okay? However, sometimes you might not have this in some sling. I guess possibly on this one. Do we have it?
There is no.
Okay, it's not there, right? Yes. Okay, so sometimes people cross over.
Yes. Keep the legs.
Please cross. Okay? So you please cross it in the absence of that, so that it avoids the pull over. Okay? So please cross it. Please cross it. Okay? So we put it this way. It's one, there is no dignity in putting the patient, and sometimes you can injure, it's an abnormal position for your next or muscles in the groin area. Okay? So now this is our slope down is here. Now we're going to bring our point. No, it's usually battery connected. Yes, it's usually battery connected. Fully charged.
We don't have automatic.
That's the remote drive. I take it up, you take it up, or you take it down. So we try to bring it down. Some of them are a bit faster than this. What you need to be aware of, you need to be mindful of the patient head when you're doing that. Yeah. So we want to do the slings. So we want to sit him up. So we want to belong. So let's go for yellow. Slow down. And then red up. Probably not the things. Let's go for example. Let's go for this. Let me bring it down. No, but she was not. So, one person will need to be operating this. We will first of all bring the patient up, and then the person will operate this, and by bringing this, and then pick it up. I will stay with the patient. You want to operate this? Yeah, let's go. Just press it. Relax. Yes, so that one has an extra point. Which one? There are different slides.
Assume you have full neck control now.
Now bystanders go.
That's fine. Inpatient coordinator.
Bystander.
You need to operate. No, just that's it. Slow down. Why did the next? Now bring it towards me. Hello, when the patient is here, when the patient is here, because you have been adjusting the patient in the chair, you need to be aware of slouching, because this patient attention and not have this. So there are different ways you can. Some of them have straps that you can pull. Some of them have straps you can pull, but sometimes if they don't have straps, I use this bit to just make sure that they are seated when in chair. So we go to lower him down. And be mindful of his legs, just lower him down, lower him down. Listen. Is it now? No. Somebody stay with him, please. Yeah, that's it. Okay, emergency. Press there. Somebody press there. Emergency. Come on, down. The mindful of his legs. I love with him. Yeah. If somebody can. Good. Thank you. That's it. No, that's fine. Just bring him all the way down. His left. Mindful of his left. So, just go down. On the way bring it down a bit more. As it happens. It's okay. Then you remove the slings. And then you take it out of there. Now, this is one. So if I did not hold my hand and put it, there is tendency that it will just slouch. Okay? When you bring him down, you just see him slouch. Or maybe let me show you without me putting my hands down. You want to bring the same video. And sometimes you can leave the patient here when they are sitting in bed for 2-3 hours and then you bring them back. It's not like slide shoes that you have to remove. If you are just in it or you don't want to, you can remove it, keep the patient and bring it back.
Safety of the patient's forehead.
So you want to remove this person. Yes. Bring it down. Please. That's okay. Now bring it up. Take Suleiman all the way up. Bring it all the way up. Assume them. Somebody say assume them control.
Yes.
Okay. So let's say this is Suleiman like this. I'll try to bring him into the chair. Look now, you lower him down. You can see how he's now slouching. Okay? But again, you want to slightly bring him up. Yes, he's slouching. Bring him up a bit. Bring him up a bit. Bring him up a bit. Up a bit. So some have straps that you can pull, but even without straps, without just pulling here, and then you bring him down. He's now well supported. That's it. And if you have to remove the slide, the sling, okay? We remove it. We remove the strap. Okay? What I will ask you to do is you will lift one of the leg. Go. And let that put it out.
Common sense that is not common. Good.
And then yes. So if you are putting it back into bed, if you are putting it back into bed, you bring your head back. No, sorry, bring your head forward. Lean forward. And then we put it back again. You will do another one. Somebody wants to try? So with that, now it all depends on how they come with the design. But this one, what they have, we color coded it, which is good in the sense that if you are going for the yellow one, you should match with the yellow one, okay, on the copper color. But what I'm saying is that in terms of the ceiling itself, you can, apart from the color, you can gauge it. If you are sitting, if the person is sitting down, you want the lower lip to slightly be longer, which here is already long, the yellow one. The upper lip to slightly be shorter, which the way they design this one is shorter already. So there is no need for him for us to change the color, for example, to red, which we can anyway. But I think the yellow one and the yellow one matches in terms of the yellow one up will bring him up because the upper part of the body is sitting down should be short, the lower part of the body should be long. But when he's lying down, we try as much as possible to take it long and long. In this situation, well, yes, long and long because it's going on in the supine position.
In line.
Yes. In this situation, I can decide to use green, or I can decide to use green and yellow. In the sense that yellow here will not work for me because yellow here has already been tilted. So if, for example, you want to write down, if I'm using yellow here, I know the yellow automatically will bring this leg down. But I here up, the yellow here will maybe bring it forward. So I may decide to use green here. So that when it's lying down, when it's up, it will just be lying down. But again, green and green here will also serve the purpose. Okay? So when you're lying down, you just make sure that the rope you are using allows you to assume the position you want him to take whenever you take him that way. Okay? So we bring it up. So I will bring somebody else. Bring your hands across your chest. Asha already?
Ba ka son ku yake ba?
So let's go and put it back.
Okay, what about gurin ku Mr.
That's it. So now that's bring it in.
Baka sa ni baka tafi na ina ma aiki.
The way it's driving is smooth. That's really complicated. That has that one. So we just tilt it. And with this, we try to adjust it as high up as possible. That the height can come. So I think in terms of this, that's been simple. That's fine. Drawing it down. Drawing it down. Drawing it down.
Okay, lokacin nan da ka biyo gurin mu ba, da kai okay lokacin Sokoto kace ai. Sokoto kace lokaci. Amma dai kan wani Maiduguri jirgi ka bude ba mutane. Ai ne garin nan ma dan ma ina ma Kano ne wallahi na tuno amma. Kai garin nan ba hanya. Haka. A kazani da yake na jima ina ga tun fa kafin 214 rabon da ba hanyar nan. Wallahi na ni ai lokacin da na san ta hanyar iso ni ba tun 2014 ban biyo hanyar nan a mota ba 2012 lokacin da kai tafiya muna fadin Murtala gabanin zan tafi Sudan exactly ka tafi ba flight ba wai wani guri ba sai ka tsaya ba ka za da dai na san na zuwa na daga bambam zuwa namun da zai yi hanyar ba last zuwa to ni a ce gaba ɗaya na manta da wancan ni ba ce kila ita da canje patent tax na juwaya tana ta iyo ba shiri na tashi Suleiman, wallahi ka ce gwargwani. Wai ba da allowance na subject ne? Wai ba da allowance na subject ne?
Ka ba shi mutum
Allah kuwa.
Kuma wallahi a gariyar na mabibi ya ga buga da shi.
Balai ma. Sorry. Wata fashion ita ce a gida.
All right, hello. We are almost there. We're going to do one more and then it's going to be practice throughout the evening. I know it's almost 4 o'clock and we meant to finish out 4:30. When the patient has fallen on the floor, usually I guess here it's just let's go and help you, let's go and help you, let's go and help you. In other places there are protocols or policies to follow. Okay, when the patient has fallen on the floor, or when the patient is falling, and when the patient has fallen. When you are moving the patient and they are about to fall, some policies is you do not intervene. You allow them to fall because if you intervene, you are more likely to cause more injury to them because you might redirect their fall to a point whereby they might injure themselves, and some of them can sue you that you are the one that caused more injury. But again, I understand sometimes we might just want to help. Okay? There is that human instinct that when the person is falling, you are rushing to help. Okay? You are rushing to help. Can I have a volunteer? I guess we have to let Suleiman to rest. Do you want to volunteer? No. Yes. So the doctor will give a piece. Sorry? Yes. We take to for Hello. If you are working your patient, we work our patient daily anyway. So I'm going to what's the name? So when you are working a patient, okay, it's the same things you want to call a patient. When you work, if it's one person's work, usually it's good to put your hands up because at this level, if it's going to fall, I can control the weight. Yes. Okay? I can control the weight. So just the manual guidance that I'm giving when you are working. So that's the back you want to turn around. And in front, it's recommended never allow the patient to lock their hands up. It's not a good practice because when they are falling, they will drag you. They can take off your hand, they can injure you, they can fracture you. So don't lock your hands with the patient when you are supporting them. Usually you can put your hands something like this, whereby they don't have anywhere to breathe, and even if they are breathing, you can easily detach yourself away from them. So when you are, I can put my hands like this, not necessarily to back. Of course, we use crutches, aid, and everything. But sometimes when you want to just put them in a bit of support. And then here and then the passive work. But every time we stand with this, just so working with the patient. But when a patient is falling, there is this guided fall. Sometimes when you are close to the patient and the patient wants to fall, you want to do as if you were
Break it down.
Okay? So you break it down, just allow him to slide and you break down.
So I can fall graciously.
Yes.
Graciously.
So you can break down, you can just slide them down. Slide them down. That's but again, like I said, there are different policies. If there is a policy around in your settings, it's something that you should encourage to do. And then from here, now I can tell you that you will fall on the floor. I remind you, you want to fall on opportunity or you want to do that. Mash. So if the patient is on the floor, if the patient is on the floor, sometimes if they can't get on the floor, what you can use is the hoist. That we just demonstrated. And the same way you use the hoist from them to bed is the same way you use it when they are on the floor. You put the slings by rolling them from side to side, and then you bring the hoist. Some of the hoist will go all the way down, and you put the hoist slings on it, and then you bring the patient up. You are adjusted to the chair. But if the patient has some ability, and I think we talked about it in our online session, there are some patients that they might be frequent callers and they struggle. So this type of patient, you want to empower them how they can get up, even do another. Okay? So there is what they call the backward chain. The backward chain. I think some people have used backward chain from my online session. Some people have. Okay, but what? Anybody have used the backward chain? No. Okay. So backward chain is basically a way where you can enable the person to stand up. If it is they are struggling to just get up like this as normally we do. Okay. You start by rolling them. Let's say they are falling, and maybe they are lying facing up, as in looking up the sleep. You start by rolling them into the sleep, onto their one side. Okay. Whichever side. You start by rolling them into the one side. The same way we did the rolling in the morning, whereby the person is rolling one side, that's the same process. Okay? So we roll them into one side, and then from one side, we try to bring them into 4 points kneeling, or you can bring them into their tummy, whichever one is easier for them, and then into 4-point kneeling. And then from 4-point kneeling, they move to 2-point kneeling, and then standard standing. And they will need a chair or bed, but we'll come to that as well. So if you are rolling them to one side, let's say this is my patient, and I will just roll the patient to one side, the same process. And then if they are rolling, I can put them into. So try as much to have some ability, but you don't have a lot. So from one side, I'm going to roll, just roll from one side. Roll to one side. Good. So we're going to go into 4-point kneeling. Yes. Just stay in the 4-point kneeling. Some of them from this 4-point kneeling, all you need to do is you can bring them to 2-point kneeling. So no.
2 point.
Okay. Sit on your this bit. Okay. Then from the 2-point kneeling, we may need and we use a chair without that. The chair right in front of us. Is it possible to do it? What the No, this is what it is. Just from the 2.2. So they're going to go into one next time. They try to bring one of their legs up, and they just put your hand, and then try to come up. Okay. And some of them can go all the way up, while some of them cannot. For those that cannot, from this point, push this leg forward. But for those that cannot, we need to find another second chair behind them. Once they are in this position, they just sit. Okay? It all depends on their ability. Can we try without the just try for that? It's okay, we just that. Go back to the okay? So we're going to get another chair. Put your hands there, put your hands there. So one leg, just try. So somebody should come and we push this leg for you. Okay? But yes, that's it. That's how much you can go. Okay? You don't have to stand up all the way. Okay? And you can support them and then you see. Okay? That's for those that cannot. While those that can, let's say you are trying to train them where they can do it on their own, you can train them with the 4.0 where they can put their hands and from there. So let's take this way. Let's assume we want to train them by yourself. Let's go back. Bring the leg back, forward again. Bring the hand. Bring the other hand. Let's try to come up. Okay. Bring the other leg. And then from here they can be able to stand up. Okay? While some of them, all they need to do is just turn around and just sit down in the chair. Okay? And then sit down in the chair. Okay? It all depends on their ability. Yes, how do you do it?
The only difference I realized in my question was from 4 points.
Yeah.
I realized you cannot bend down to put the bump up on the hips.
Yeah.
So you complain of the thigh that is very painful. So what I did was from 4 points, there is a pushing chair, very static, very stable there. So from the 4 points, we just rest with one hand, put the pushing chair, rest with the other hand, put there. Just try to get up.
Stand up. Yes.
That's why you see.
Yes, that's how it is.
So you don't have to go to the 2 points. Yes. If the patient, if you want to please come back slowly to the last one. So what Suleiman is saying is, let's go. From this position, from point A. So do the 4 point first. 4 point B. From this position, you don't have to go to the 2 point. Use your hand on the seat, and then use the other hand. And then from there you can now try to come up. I guess that's what we do. Yeah. Yeah. And then you go all the way up. Okay? So you can, there's nothing stopping you from modifying. Whatever you can figure out the patient can be able to do is what you can be able to do. Frequent callers, absolutely I would recommend for you to consider something like this. There might be some times when they will fall on their own and they will struggle really to get up.
Of course, I think even the patient I told you,
Yes.
it's only one at home.
Okay.
So why did you go to shop in the morning?
Okay.
So when you buy the box, where is the stay there?
If she comes out.
But since
5
you're
hours
going to get this,
Yes.
whether she comes out or anything,
We'll just get it. So that's the way of empowering patients. Okay? Any sort of question? Any question? Any comment? Any addition? Any clarification? Yes, it's fine.
In addition to the precautions you mentioned,
Hello, it's Miles, yes.
in addition to precautions you mentioned,
Yes.
there are other precautions that I believe is very important. Like, transferring the patient is to a kind of hydration. Is hydration first because once you start using the patient, there may be orthostatic hypotension, and we know that dehydration
Okay. And that's why I said some of them have this emergency stop, right? Whenever your patient starts to any changes in their signs, you just press this and then it rapidly brings the patient down. But again, like you said, it's important to check those vital signs, medically stable, because once they are suspended in the ear, it's not something you rush and everything. And you don't want to be in the position you are caught between the rock and the news or the sea. Yes. Any more question, comment? Yes.
The emergency button, as we are doing, I don't know what happened. Somebody touched it.
I think somebody touched it.
Stuck at one place.
Yes, somebody touched it.
I thought you said whenever you touch it.
Some of them, yeah, some of them. I think probably is this particular brand that the emergency button. There are other variations that it makes it quicker for you to slide. The ones I've used, some of them. Can I please request, we have a couple of things that we've done. One is the patient runner, two is the 4 banana board. I know we don't have all the chairs here, but we can still manage. And then 3 is the hoist. We still have a bit of time, or not. We have about 30 minutes. Okay? Can we quickly practice this for 20 minutes? I know people are tired and want to go back home. But I think it's an opportunity for us to put our hands on these pieces of equipment. Can we practice this for the 20 minutes each? And after that, we now come back and then wrap up the session. Okay? Let's practice this for the next 20 minutes. Wrap your hands on any of the equipment that you want
Haka idan ballashi. Salis.
You want to come and practice the banana boat here? Because you can adjust this leg.
Aina. Eh? Ni zan maka ne. Gwada mana. Eh? Ah, kai. Ah, wallahi ba zan ka bari za mu gwada an jima. Bari a ji haratu.
Kana matsala, ai na ganka. Ka zo mu jira Allah.
Ya Allah ka bar. Allah ka
Yanzu ko wancan ba.
Me zan gwada?
Zan iya tura su. Idan misali akwai inda nake son tambaye shi, ya za a yi? Shine magana ba.
A'a, babu
Sakon nawa ne zan tura ka?
ni ma zan iya turawa yanzu. Wallahi zan iya.
Magana za ka yi
Ba wancan ba rana ba wani.
magana ba ko kai kai ba. Ka zo na mun as model ne ni ne nake magana.
A'a. Bai kai za ka tura ni
Sai
ke.
mana ba wai nace kai bane, idan na ran ka kuma ne kadi.
Ha, okay, za ka haune tura ka kenan.
Ba sai ya gwada kanka.
Ka kaje ko ka
Misali da ni kan bi kuma ba dai bane.
ni da kuce.
Kauna. Yin da zai akan bana na bude
Suka wani ke maka wannan.
a zai cin abinci za mu tafi da shi.
A to ai ba caji ne.
To aje shi to ba sa da shi ne ba. Ana da baro ne.
Ai na ni yanzu kana suka fara da yawa wallahi ba za su barki. A da barki da gazi. yanzu step ɗaya na step ɗaya za ka yi ko biyu sai biyu ba to mu je
Ya biyu. Bravo. Na rike mishi oga. Sigero kashi. Na kamata sai a fulo. Na kamata. Bulun ta zo? Homologo. Na tura shi su.
All right. Okay. Next. Let's come back. Let's come back. All right. Let's come back and wrap up. Let's come back and wrap up. No, what's the next No, let's come back, please.
I can't do that.
So, hello. We started this journey from the 14th of March when we did an online training about patient and handling of the look at basic biomechanical principles when you are looking at animals. For most of us that are here, it's our day-to-day practice. Okay? But how we will change change the life of the patient in terms of improving their care, their recovery for physiotherapists. The more you allow the patient to do more of the things, the better for their recovery. For the patient and nurses also, in terms of both nurses and physiotherapists, the more less likely we allow the patient to be involved in doing it, there's less likely we expose ourselves to injuries generally. The whole idea is if the patient can do it, no need for you to be involved. Allow them to do it. If the patient can do it, encourage the relatives because they love them so much, yes. But let them know that if they really want this patient to recover better, they should allow them to do it rather than pulling them. Okay? We also look at different equipment that can help us. Those equipment are meant to help us make things better. I know that the availability of the equipment is a different conversation, but there are modifications that we can do in our clinics. We look at the bed rolls in the bed. You can use the slide sheet for bed rolls from side to side, up and down. We looked at part slide for those that are here in the afternoon. The part slide we talked about you can use after surgery, transferring patient from one bed to the other, from the bed to the theater bed. We looked at patient stroller. We said it helps in terms of lifting patients when they are standing up for patient rather than holding them. We said we look at banana board, but we say banana board is liberating for the patient, it's empowering for the patient. We also look at mobile phones. We say the mobile phones, if the patient is totally bedridden, but there are safety precautions. One thing you don't want to do is patient suspended in the air and something happens. Okay? Always check the medical record of the patient at this table. You will be able to, as is okay for you to mobilize them. Okay? These are all the things we've considered today. One of the main things we talked about is the awareness. Okay? Hopefully, this is a conversation that started now and will continue with you, but also with your patient, with the patient relatives. Tomorrow will give us an opportunity to take everything we've learned today into our clinics. The idea is tomorrow it's an independent self-practice, but for our guests that are here with us, the HOD has arranged. They will come here by 9 o'clock and they will have access to the wards. They will have some of the therapists here with them. I also will be around with them, and some of the pieces of equipment will be around with them. There is a logbook online. It's all up to you. You can either print it or you can use it online. What I expect tomorrow is from 9 a.m. all the way to 4 a.m., 2 a.m., 1, 4 p.m., 2 p.m., whatever time you close your clinic, you should be able to at least have one single case study of a patient that A, you consider a manual handling technique for the patient, and B, you consider what are the strategies you use. Did you use any equipment or not? If you use equipment, why do you use equipment? If you don't have equipment in your clinic, for those that are online, if you are to use equipment, what type of equipment you have used to make it better for the patient? And then at the end, I want you to just do a Google search and find any evidence surrounding what you've done. Any reference, any evidence, any item, and you just attach it. And you can post it on the WhatsApp or you can send it to the email, our WhatsApp platform. We go to, on Friday, we're going to come back either here or those that are online will join us online. Friday is here, right? You see that here display? Yeah. No, you don't have to see if you can use the online platform. Okay, on Friday we'll meet on the department. Okay, that's fine. So on Friday we'll meet at the physiotherapy department and we'll discuss those case studies you consider. We will talk about what are the challenges you find, how do you find it when you're using this patient, what are the modifications that you have to do when you are using this patient, all those conversations. And then we wrap up the session on Friday around 12 o'clock, 12:30. For tomorrow, I think those that are here, there is lunch as well in the department for those that are here on ground. Okay? But before we wrap up, I want us to do one thing. I want us to come in cycles. So I want us, there will be two cycles of human being. One is those that are in the inner cycle will be facing out, okay? And we're going to start in cycles. And those that are in the outside cycle will be facing in. So you will come face to face with somebody either in the outside cycle. So you go to stay in around the cycle. Once in the cycle, those that are in the cycle, inside the cycle, will be moving towards the right hand side. Okay? One step towards the right hand side. Those that are in the outside cycle will be moving towards the left. What is this one? This one is left. So those that are in the inner cycle will move towards the left hand side. Those that are in the outside cycle will move towards the right hand side. Since I was a child, I couldn't figure out which one is my left hand. I have to touch it. So the left hand side, those that are in the inner cycle will move in the left direction. Those that are in the outside cycle will move in the right direction. But you will move on my command. When I will call a piece of equipment. When I call a piece of equipment, then you move. Okay? When you move, those that are on the outer cycle will have to tell those that are in the inner cycle what is the piece of what. So tell us about the name of the I will mention the name. What is the equipment used for? What are the safety considerations? So what is the equipment used for? And what are the safety considerations that you have to put on this piece of equipment? Okay? So for those that are in the outer cycle, and I will call another piece of equipment. We move. Those are the outer cycle will still tell us. We will keep on going down the cycle. Okay? So that's the game that we will do. So we keep on turning. In the inner cycle going left, in the outer cycle going down. Okay? The inner cycle going left, in the outer cycle going down. Is that clear? Okay? Can we come and get from a cycle, please? Two cycles in this one. Let's make this one. No, just one good. Yeah, that's it. So are we clear now? Yeah, that's fine. That's it. All right, are we ready? So those that are outside cycle will be telling us, or maybe why don't I do this way? In the inner cycle, when we say move, you guys will pick an equipment. No, I think it will be too characters. I will mention the equipment. You guys will move. The outside cycle will be the one to tell you the purpose and the safety. Okay? Are we ready? Slide sheets. We have to move. Slide sheets. So, yes. Outside cycle should tell us the purpose and the safety consideration of using the slide sheet. You tell the person in front of you. Tell the person in front of you. You tell the person in front of you. What is the purpose of the slide sheet? All right, let's move again. Bed levers. Bed lever. Bed lever.
والله يا اخي وقت كانت كده هي اوبشن كمان
To avoid it.
ما شاء الله
Patient corner. Patient corner. Let's move again. Patient corner.
So the patient owner, listen to me, I think a lot of people for the patient owner, if you teach the patient functionality right for voice access, yeah. You mentioned something about those that are patients also have to have some level of because it's going to have therapy understand by the side. One of some students also find and then the safety goes if the patient takes one therapy by the side and the one is level of cognition. The patient has to be cognitive and good balance and coordination together.
All right. Let's move one more time. Two more times, but this time around, just in the middle are the one that we talk about. So we're going to move two more times, but in the middle, you are the one telling us the information. The same way. Let's go now. Slightly again. Slightly again. Those in the middle. Transfer.
Boys, boys.
Wannan haifa ne. Wannan na haifa.